A nondescript building in rural Oxfordshire, a new and unlikely battlefront against COVID-19. We've been given exclusive access to Public Health England's contact tracing nerve centre for South England.
So we might identify 3 or 4 people in that setting that we have to...
Trish Mannes is an epidemiologist with more than 20 years' experience of stopping the spread of infectious diseases. Her team's work was critical in slowing the spread of COVID-19 when the first clusters were discovered in Brighton.
There are methods to find people you may have been in contact with. An example is, I went to the gym last night, I was there for an hour. I don't know any of the people that I was within 2 metres of, but we can go back to the gym and ask them who was exercising in that class, and they can help us identify those people.
But now, as we look towards an easing of restrictions, contact tracers will take the lead in preventing a second wave.
The focus is about bringing the reproductive number below 1, and so the R0, or the reproductive number, must stay below 1 if we're going to contain this. Contact tracing allows those social distancing measures to be relaxed so that we can minimise the spread from anyone who has the disease.
The data collected by the COVID-19 tracing app launched here on the Isle of Wight will be used by contact tracers to identify and stop potential outbreaks. New technology working in tandem with traditional infection control methods. The work has been relentless and exhausting, and there's no sign of it easing up.
It's very intense for the individuals doing the interviews, but of course it's really intense for the people on the other side of the interview. They're obviously feeling concerned about who they may have transmitted this to, very guilty, particularly very early on.
Have you felt overwhelmed at any stage?
It's a good question. I think I've always felt challenged, and I suspect there are challenges to come. It's very, very difficult working in a new emerging field, with new emerging science, with a scale that we don't recognise.
The work being done by Trish Mannes and her teams can't be understated. Simply, it will help to stop more people dying and for others to start living again. Ashish Joshi, Sky News.